A cancer diagnosis can be a frightening experience. It's a leading cause of death worldwide, with approximately 10 million people succumbing to cancer in 2020 alone. Colon cancer is one of the most prevalent types, affecting thousands of individuals each year. In the United States, over 100,000 new cases are reported annually. The key to battling this disease lies in maintaining a healthy lifestyle and catching it early. Being aware of the early signs and symptoms of colon cancer is crucial. That's exactly what we'll be discussing in today's video. Why you should be concerned about colon cancer. Colon cancer is not just another health issue, it's a major one. According to experts, colorectal cancer ranks among the top 3 cancers in the United States, both in terms of prevalence and mortality rates for men and women alike. Contrary to what many might think, it's not a disease that only strikes later in life. Recent studies have shown a concerning rise in colon cancer cases among people in their 20s and 30s. This makes it clear that understanding and recognizing the signs and symptoms of colon cancer is crucial at any age. One of the earliest signs of colon cancer is rectal bleeding. If you notice blood in your stool, it's important to consult your doctor immediately. The blood could appear either red or dark maroon. Bright red blood typically indicates that it's fresh and that there's an issue in your lower digestive tract. On the other hand, dark maroon blood suggests it's been partially digested, signaling a problem in your upper digestive tract. Bleeding might also result from less severe issues like hemorrhoids or a minor injury, but the bleeding caused by colon cancer tends to be more severe. Many people overlook the importance of inspecting their stool regularly. However, this simple habit could be a lifesaver, helping you spot colon cancer early. Rectal bleeding often goes ignored because it can be intermittent, making it easy to dismiss when it stops temporarily. But don't be fooled. If you experience bleeding, even if it comes and goes, seek medical advice right away. The earlier you address this symptom, the better your chances of successful treatment. Another sign to watch for is a change in the shape of your stool. If your stools become narrower than usual, it's time to see a doctor. You can only notice this change if you regularly check your stools. Changes in bowel movements can also indicate colon cancer. For example, persistent constipation could be a warning sign. While self-diagnosis is not advisable, discussing any changes in bowel habits with your doctor is always a good idea. Keeping an eye on your stool's shape and consistency can give you an early heads up about potential health issues, allowing you to take timely action. Aside from monitoring your bowel movements, getting regular blood work done is essential, particularly to check your hemoglobin levels. Low levels could indicate anemia, which might be a result of internal bleeding caused by colon cancer. Constipation is a common issue with many possible causes, such as a lack of dietary fiber. Typically, it doesn't last long and can be remedied by increasing your fiber intake. However, if constipation persists without relief, it could indicate a colon tumor. Persistent constipation not only impacts your comfort, but could also exacerbate the severity of colon cancer if left untreated. If you've been dealing with constipation for an extended period, it's crucial to seek medical attention. Your doctor can determine whether a tumor or another underlying condition is the cause. Don't ignore long-lasting constipation, as it could be an early sign of something more serious. Have you ever felt the urge to have a bowel movement only to find that nothing happens? This sensation, known as tenesmus, can be uncomfortable and is often associated with a tumor in the colon or rectum. If you're experiencing frequent instances of ineffective bowel movements, it's essential to consult your doctor. This could be a sign of colon cancer, and the sooner you address it, the better your chances of managing the disease. Tenesmus isn't just an inconvenience. It can be an important clue that something is amiss in your digestive system. By recognizing and addressing this symptom early, you can take steps to diagnose and treat any underlying issues, potentially catching colon cancer in its early stages. Anemia is another sign that could indicate colon cancer. Tumors in the colon often cause blood loss, which can go unnoticed unless you're specifically looking for it in your stool. However, there's another way to detect if you're losing blood internally, through a blood test. Anemia occurs when there's a decrease in your red blood cells, and there are many possible causes for this condition, including bleeding from colon cancer cells. If you find out you're anemic, it's crucial to explore whether this is due to blood loss from a colon tumor. Regular blood tests can help catch anemia early, allowing for timely investigation and treatment of any underlying causes. Abdominal pain is a symptom that should never be ignored. It could be a sign of many different health issues, including colon cancer. When a tumor causes an obstruction or a tear in your intestines, it can lead to cramping or severe pain in your abdomen. This pain can be constant or intermittent, but it's usually uncomfortable enough to disrupt your daily life. Tenderness or sharp pain in the abdomen could indicate that something is blocking the normal flow of your digestive system, causing the discomfort. You might also experience nausea and vomiting as the tumor causes bloating in your belly. If you're experiencing any of these symptoms, consult your doctor as soon as possible. Early intervention can prevent the tumor from spreading and increase your chances of a successful outcome. Sudden, unexplained weight loss is often a red flag for serious health issues, including colon cancer. If you notice that you're losing weight without trying, and especially if this weight loss is accompanied by any of the other symptoms mentioned, you should seek medical advice. Weight loss is a clear sign that something may be wrong with your body. Keep track of your eating habits and monitor your weight regularly. If you've been eating normally but still losing weight, it's important to get evaluated. Tumors can interfere with your body's ability to absorb nutrients and properly utilize the food you consume. This disruption can lead to a lack of energy and unexplained weight loss, which could be an indication that colon cancer is affecting your body's functions. Nausea is a common symptom that can occur for many reasons, but when it persists for an extended period, it could be a sign of something more serious, like colon cancer. If you're frequently feeling nauseous and experiencing vomiting, especially without an obvious cause, it's important to consult your doctor. Colon cancer can cause intestinal blockages, leading to feelings of nausea and discomfort. If these symptoms persist, they should not be ignored. Early detection of a tumor can lead to more effective treatment options and prevent the cancer from spreading to other parts of the body. Colon cancer progresses through 4 main stages, each indicating the extent to which the cancer has spread. Understanding these stages can help you grasp the severity of the disease and the importance of early detection. Stage 1. At this stage, colon cancer has spread from the lining of the large intestine to the muscular wall of the intestine. It's still in its early phase and is more treatable. Stage 2. The cancer has reached the outermost layer of the intestine's wall and may have begun to spread to nearby organs. This stage indicates a more advanced progression of the disease. Stage 3. By stage 3, the cancer has spread to nearby lymph nodes or other organs. At this point, the cancer is more aggressive and requires more intensive treatment. Stage 4. Stage 4 is the most advanced stage, where the cancer has metastasized to other organs such as the liver, bones, or lungs. This stage is the most challenging to treat and usually requires a comprehensive approach to manage. There's also a stage 0, which refers to a very early form of cancer that affects only the lining of the intestine. This is sometimes referred to as cancer in situ, and catching it at this stage offers the best chance for successful treatment. If you experience any symptoms that could be related to colorectal cancer, or if a screening test shows something abnormal, your doctor will order further tests to determine the cause. Understanding your medical history, including any potential risk factors, is a critical part of this process. Your doctor will also conduct a thorough physical examination, paying particular attention to your abdomen and rectum to check for lumps or other abnormalities. Depending on your symptoms, additional tests like colonoscopies, biopsies, Connecticut scans, ultrasounds, and various blood tests may be recommended to assess the size of any tumors and whether the cancer has spread. Today we've covered some of the early warning signs of colon cancer, as well as the different stages of the disease. Remember, staying informed and vigilant is your best defense against this serious illness. By recognizing the signs early and seeking prompt medical advice, you can increase your chances of successful treatment. But colon cancer isn't the only health concern you should be aware of. Your body often gives subtle signs that something is wrong, and it's essential to pay attention to them. If you found this video informative, please share your thoughts in the comments below, and don't forget to like and subscribe to our channel for more valuable health tips. Stay healthy and stay informed.